This is Yolanda Neal reporting on a single car accident victim that arrived at the emergency room. The date is 11/25/18. Emergency services, medical services personnel arrived at the hospital with the following person: Mr. Don Smith, who was the unrestrained driver in a single motor vehicle accident. Upon arriving at the accident, EMS personnel received the following information. Mr. Smith is a 33-year-old male, date of birth is 7/1/85. He was the unrestrained driver in a motor vehicle accident. He is complaining of pain to the left lower quadrant, left upper extremity, left lower extremity, and to his head. Mr. Smith denies having any loss of consciousness or dizziness. Vital signs at time at the scene were as follows. He is hypertensive with a blood pressure of 165/84, tachycardia with a heart rate of 108, respirations are tachypnea at 24, temperature was 96.8, and pulse oximetry was 98% on room air. EMS personnel stabilized left lower extremity by applying a splint. Left upper extremity was placed in a sling. Laceration to his forehead, a gauze was placed and now has some bloody drainage on it. The emergency room physician examined the patient and received the following history and physical from the patient. Patient states he is a diabetic type 1, which means that he doesn't produce any insulin. History of high blood pressure, hypertensive, scoliosis, asthma, gastric reflux disease, depression and anxiety, nephrolithiasis, and high cholesterol levels. The doctor will now perform an examination of each system. On the integumentary system, he noticed a laceration to the forehead with a small amount of bloody drainage, a 2-centimeter hematoma to the right of the laceration, contusions to the left elbow, abdomen, and left patella, left elbow bone pushing through the skin, which indicates an open fracture, edema to the left patella, and pain to the left upper extremity, left lower extremity, and to his head. On the examination of the musculoskeletal system, the doctor noted again the bone protruding through the left elbow bone protruding through the skin, and edema to the left patella area. Again, it is noted that the patient has a history of scoliosis, which is basically a curvature of the spine. Cardiovascular system, the patient does have a history of hypertension, with his blood pressure being 165/84, tachycardia at pulse rate of 108, and he does also have a history of high cholesterol levels. On examining the respiratory system, the patient does have a history of asthma, and again the pulse oximetry on room air was 98%, but he has tachypnea at 24. On the review of the digestive system, the patient does have a history of GERD or gastric reflux disease, complaint of pain to the left lower quadrant, and he does have contusion to the left lower quadrant. In that quadrant area, the stomach, the spleen, part of the liver, upper part of the left kidney, and part of the colon. In examining the urinary system, the patient does have a history of having kidney stones, which is nephrolithiasis. Again, on the examination of the endocrine system, the patient is noted to be a diabetic mellitus type 1. Examination of the nervous system, the patient does continue to deny any loss of consciousness or dizziness, but he does have a hematoma on the forehead. Psychological exam shows that the patient does have a history of depression and anxiety. Treatment plan, the doctor will order a urinalysis, a toxicology screen, the following lab, a comprehensive metabolic panel, chest x-ray of the spine and chest, computerized tomographic of the scan of the abdomen and head without contrast, or orthopedic consult, a psychiatric consult. He's going to admit him to the medical surgical author unit. Patient will remain NPO, which means he will have nothing by mouth. IV will be placed so he can get IV pain medication, anxiety medication, and IV fluids. IV fluids are going to be Destro 5 with normal saline, which is basically normal saline with some sugar in it. Blood sugars are going to be mono AC and HS, which is before meals and at bedtime. Patient is also going to be placed on O2 at 2 liters, just so that he is not breathing so hard. That concludes my examination of the patient, and thank you.